Welcome back. You're listening to More Than Child's Play, where we prioritize play and marvel at every miraculous milestone. Hello, welcome back to the More Than Child's Play podcast. This is your host, Nicole Surgent. I am thrilled as a physical therapist today to have and host one of my favorite physical therapists that I admire so much. Susan Blum is with us today. I just want to tell you a little bit about Susan before we start our conversation. Susan obtained her degree in physical therapy in 1975. She is the owner of Susan Blum Physical Therapy, a private practice specializing in the treatment of children in their natural environment, and she empowers their caregivers. Her practice includes treatment of children and adults with a variety of issues, including cerebral palsy, orthopedic issues, gait asymmetries, torticollis, developmental delays, and other neuromotor disorders. Her office is in Philadelphia, and she treats patients there who have complex developmental challenges and provides coaching for therapists and their patients with most complex challenges. Susan specializes in mentoring therapists across the world in developing care plans for children and adults who have profound motor challenges. In 2021, she was the recipient of Pennsylvania's Pediatric Special Interest Group Award of Excellence for her contributions to the pediatric PT profession. After discovering the step-by-step total motion release method concept in 2008, she applied that systemic methodology to assess and treat her pediatric patients. The improvement in functional outcomes far surpassed any seen in her previous experience, and this led her to the development of TMR for Tots in teens, sometimes known as Tots. Earlier in her 50-year career, Susan had extensive experience treating adults with neurologic, orthopedic disorders in hospitals, clinics, home health, and school settings. She applied that experience, extensive research, continuing ed, and studying to develop that TOTS program. She has taught the TOTS concept to over 4,000 therapists, I'm proud to be one of them, worldwide, and presented the concepts at numerous state, APTA, and international conferences, including, impressively, the International Fascial Congress. Susan continues ongoing study of cutting-edge science supporting the TMR concept and networking with therapists collecting data for future publications. Included in her research is a grading system to analyze patterns of postural asymmetry related to associated developmental issues, including torticollis and cerebral palsy. That's quite the bio. Welcome, Miss Susan. Thank you for being here.
Well, I'm excited to talk to you, and I always like to be in touch with you. So it's great to have people around the planet that are taking the concept and running with it. So
Amazing.
Here we are.
Can you tell us, for those who do not know anything about total motion release, how would you define it?
Well, TMR is a therapy assessment and treatment concept which utilizes a scientific methodology to provide a very targeted, individualized plan of care for almost any issue that a child or an adult might have. It's a modified version, that TOTS is a modified version of the original TMR, which was developed to help a parent empower a patient to be able to treat themselves, identify where their motion was blocked, and for rehabilitation. And I developed a spin-off for empowering caregivers and children alike to be able to teach them therapeutic positions of comfort, therapeutic positions of play, ways that they can incorporate healing into their daily routines for a tear-free treatment activity. And this then helps the child continue to improve between therapy sessions, decreasing the amount of hands-on therapy a child might need and giving them the repetitions needed for motor learning so that they can own their evolving, emerging skill.
Amazing.
So,
how did you first hear about TMR yourself as a therapist?
Well, there was a email blast that talked about TMR, and I was looking for a way to help a child who was turning to, couldn't roll, couldn't sit, and we were just trying to keep him alive because of his contractures. He had a torticollis, he had hypotonia, a genetic issue. He was in really, really tough shape, and we were looking to get some kind of a wheelchair. And a year later, he was walking. When I took the course, I was searching for something. You can go to the website TMR Tots, tmrtots.com, and look at the documentary that has been submitted to a film festival called Solution. Like the word solution, the little boy's name is Lucian. He's now 19 years old and plays basketball and soccer.
Wow.
So I was looking for something. I'm a continuing ed addict, and I was looking for something to help him, and it changed my world, and now thousands of children.
Yeah, I can say myself the way that I came to it was I was on pediatric physical therapy groups on social media pages, and specifically when people were talking about torticollis, they were using terminology that is part of the TMR world as part of their regular vernaculum, and I felt out of the loop. Like I don't, they're using this, they're saying it works, it's more effective than some traditional ways we were taught as therapists, and I felt like I was really missing out. And that's when years ago I reached out to you and asked you to come here to our local hospital in Martinsburg, West Virginia, and sponsored TOTS 1 for you to share your expertise with the therapist in our region. And I will say, I tell new graduates all the time, I wish this was the first CEU course I would have taken as a new graduate because every single day since that weekend of TOTS 1, I have used TMR with pretty much almost every child I've treated since then. I find it to be the most useful tool in my toolbox. And I agree with you. I've seen it myself, the significant difference it can make, and also how easy it is to educate and share with parents of all levels of different backgrounds and educational abilities. So I can understand how when you first learned it, it sort of changed the way you practice because it certainly has done that for me. Um, what's the journey of how TOTS evolved? So you learned about TMR, you started using that with your own clients. How did that lead to TOTS evolving?
Well, if I may, I just want to run back to highlight a couple of points about TOPS because that may answer that question at the same time. Is
Great.
because TOTS, the assessment and treatment system, which the assessment takes 2 to 3 minutes to find the blocks or limitations that have hidden potential, where a previous therapy may have not uncovered that hidden potential because their range was limited, or, for example, a child, their infrastructure is off balance, the child's balancing more on one sits bone, which is affecting their ability to develop fine motor control, to write, to feed themselves, etc. And so that discovering the hidden potential, then in getting the alignment, developed a foundational base upon which my friend Lucian was able to have the process over many months of learning to sit up step by step by step, using graded control the way my infant grandchild is learning to sit, not by doing any type of dramatic thing in the clinic, but day to day little pieces of building on their strengths. And so it uses the principles of neuroplasticity and motor learning to develop this plan of care so that they own it. They own their emerging skill, looking at the building blocks. So when I had the children, which primarily were not the ones with torticollis, but the kids that had CP or hypotonia or genetic issues, the ones with complex issues that I was seeing, that's where I started with TOTS. And then everybody said, "What are you doing? What are you doing? The kids are achieving things I've never seen happen before." And it blew my mind. And then I started seeing kids with torticollis, which was something I used to go, "Oh no," when because it was so difficult. I didn't want the children to endure medically induced trauma from stretching. And then I found applying the same concept to working with the kids with tort and seeing that improved their range and their control rapidly. The parents were comfortable treating the child and not afraid. And it was how they held them, how they fed them became therapy. That was healing for them. And then people said, "Oh, okay, what are you doing? You need to teach this." And so had help from a lot of mentors to learn how to put a program together. And now we have 3 levels of education, and parents and therapists alike come to level 1. And I'm in the process of developing a mini course just for parents too, as well.
That's wonderful.
So
I,
it just blew me away too, because in discovering that a symmetry in mobility, perhaps a child could rotate more easily when their chest to the left versus the right, how that affected their whole body from head to toe, how a bias of having a block in mobility to not be able to turn your breastbone to the right, for example, might make the child appear to have left-sided weakness because they're not using their left arm because it's pulled back. How that tension could contribute all the way down into their pelvis, causing contributing to reflux. If you stand up like you're standing on a surfboard, then you try to do a pelvic tilt, you can't use your glutes. It might affect a child's ability to take a step forward, and try to do a Kegels in standing on a surfboard. It may affect a child's incontinence. And so it's total motion is total body, total child, total family. It's the whole package.
yeah, absolutely. I will also say, I think I graduated from physical therapy school around the time when we were sort of losing as a profession therapists who had the autonomy to spend a lot of time with their hands and develop those natural instincts with manual skills. I remember the professors when I was in PT school, how it seemed like when they were assessing us or assessing a patient in front of us, they had sensors in their hands. They could automatically go to the problem, they could feel it out on the body. And I felt like that muscle was underflexed in my professional ability because with managed care and insurance changes, there was a limitation. I was seeking a continuing education course that would give me a systemic way to learn to be a better manual therapist. And Tots was definitely it for me. I, with your guidance, was able to, peel the onion and learn to use my hands in a systemic way. And obviously, that's gotten better with practice, but it gave me a lens to do that. So, if any therapists are listening who are in the same boat I was in about, gosh, probably close to 15 years ago, this is an excellent course for helping you develop those skills in a systemic way. I've really appreciated that about it.
Well,
Uh,
I'm really happy when people do get that skill, but I also don't want people to feel pressure that they have to have it. You know who has that skill the best is the parent. And I say
mm,
to the parent, when you hold your baby and they're leaning against your right forearm and you're trying to settle them down, and you move them this way and that to get the child more comfortable, you're moving them into a direction of ease. And that is the healing position, the shortening position that purges the metabolites that out of the tissues, that brings blood flow in, decreases the neural tension, and makes the tissues extensible. All they have to do is go a little bit deeper into ease, like taking a fork stuck in a kitchen drawer and moving the drawer in a little bit. The parent intuitively knows that, but a lot of the therapists are like, whoa, I don't have any background in manual stuff. We can still assess the child by observing their preferred way to move, by observing that they play with their toys more on this side than that. And so we can also use TMR Tots with a child, say, that has autism that doesn't even want us near them because
exactly.
they're overwhelmed. And so it's very versatile that way too. But you will develop as you're doing this improved manual skills, which
Yeah.
is amazing,
I often
especially.
say to the parents, I remember you saying, look at where the wrinkles are in the
Uh-huh.
onesie. What side are they
Yes.
scrunching? And I'll say to the parents, do you see all those wrinkles on the right side compared to the left or whatever? And
Yes.
it's a very parent friendly method as I agree with you on that for sure. So I think you kind of hit on what about TMR stood out to you in many ways as a preferred tool in your toolbox, and that it was it was intuitive to parents. It was not painful for children. It promoted natural, healthy tissue quality and not
Mhm.
micro trauma to tissues. Is there anything else about it that we haven't talked about that you feel like really stood out to you as a preferred tool in your toolbox?
Well, I'll jump in and say this. When someone calls it a tool, I would say, well, I do not consider it a tool. I consider it more the toolbox, the structure in which you, as the skilled therapist, place your individual tools.
I love
And
that.
so that it is a perspective. It's a perspective of having great expectations that the child has hidden potential, and we can now find the way to tap into that. It's a perspective of looking past the place that is the issue. For example, if you have a child that is toe walking, well, not just looking at what kind of braces can I put on them, but what's happening all the way up to the top of their head that is causing the toe walking. It's a perspective of breaking tasks down into bite-sized pieces, following a route that the kid down the street uses in learning to do something. A child that might be tight on the left side and shift more weight onto one sits bone, how is that tightness on the left side easily treated by the child shifting further onto the sits bone, which is fun, and then doing the part B and C of a Tots session, the first being to shorten the tight tissues, the second being to explore the new length and new ability to, in that example, weight shift. And the third one, maybe to bounce up and down on their bottom and integrate that and own the new alignment, which they may never have been in before. And so we're looking at the motor learning, and targeting the motor learning very precisely with when we measure with the methodology on the form, we measure how much more can they weight shift? How are we going to facilitate, or in parent friendly terms, bring their attention to the right side to contract, to hold that posture, and carefully measure that. So I'm it's so many things, but I am just blown away by how, when we find a block, how a child may then achieve something that previously I never anticipated they could. For example, a child with a Down syndrome typically has delayed gait, but they're also typically flex forward. So I say to the parent, stand up and tuck your shirt in. My daughter calls this the necktie test. She's a doctor who I work alongside and co-treat with sometimes. Tuck your necktie in your waist belt. Now try to walk. What do you do? And how do you untuck that? We're trying to strengthen their back. We're beating our head into the wall and frustrating the kid trying to strengthen their back. When, what does that individual child need? We say, what is their body asking to do? Where precisely are they folding on the front that is the tightest of the tight places that we can shorten, release, and now have the range to facilitate their back? And now, how can we dialogue with the parent and say, what does the child enjoy doing? Well, he wants to play basketball with his brother. So we have that little Tykes basketball thing. And we just determine exactly what height to put the basket so that when the child can now raise their arms overhead, which they could not before when the necktie was tucked in. Now, in playing with the basketball, with the basket at that precise height for their home program, they're strengthening their back, not doing a cookbook of stuff in the clinic, extreme motions and things to try to get their back working, but something that is targeted for the individual. If you have 10 kids with the same diagnosis, they're all individuals with unique places that they need to strengthen and need to release the blocks. But the other thing that is really exciting is we as therapists are trained to say, what can't they do? We have to practice that. Instead of saying, why can't they do it? Why does the child favor going up the step with one foot than the other? And so we're frustrating the kid trying to get them to bring the other leg up. There's something in their body that's making it harder on that side. And when we test them with the TMR system, we can find that place and unlock it. And then they go, oh, that's how I do it. And now we can use our tools that you have in the toolbox, whatever your tools are as a therapist, to get the child to activate and use the hard side. And that is step in the ABCs, the second step to be able to do that. And you're talking about the new grads too. And another place that I feel that some people are not tuned into is task analysis. To be able to break something down and say, why can't they do that? Why can't the child transfer to the toilet? Because they can't get to the edge of the wheelchair. Why can't they get to the edge of the wheelchair? Because they can't weight shift. Why can't they weight shift? Because they're stuck on one side, or whatever the limitation is. And so we have them weight shift onto the easy side, loosen up the left side. They can weight shift and progress step by step by step. But there's no magic wand. There's no quick fix. And unfortunately, so many parents are looking for a quick fix. Oh, if I had the magic bullet, if I pay enough money, if we go for this intensive, we can blast them through and get them moving. Well, TMR, the line of pull that is the tape, that is the block, is also what I call the GPS for motor learning.
Oh, I
The
love that.
child who can more easily turn to the left than the right, rotating, it will first learn to roll to the left, to reach for their snacks to the left. And then while they're doing that, they are building on their control. And then they go, oh, now they are developing the releases that make it easy for them to then begin to go to the other side. It's the GPS. It's a targeted, precise, targeted GPS.
I love that
And
analogy, and I love the you're right about the toolbox, not the tools, because the way I think of it is after I took Tots, everything else I did is through the lens of Tots. It's like I'm looking at things a different way, even if I'm looking at a variety of things.
yes, yes, and so every child that I see, I might only spend a little while doing a release, and the rest of the time is the activation. If I have a child that has a particular block, a child with a scoliosis, we have them move into ease to reduce the tension on the concave or the shortened side, and then let out all the stops with whatever strategies you might use to bring attention and strengthen the other side.
Yeah.
So then you can do it in the pool, you can do it on a horse, you can use your K-tape, you can use your eSIM, whatever you do, but you're getting the infrastructure for to build on other things.
You're resetting the GPS before you travel a new road, right?
Yes, yes, and you have to choose your GPS
Exactly.
system. And but when parents do this and they experience it on themselves, and I have them feel how the child might be struggling to stand, but now also feel what their strengths are, because I have an older child. My older child has a disability. So I understand firsthand how helpless one might feel. And when you can show them something simple to empower them, how that can change everything. Something, and so we're not trying to, I say when people say, oh, you're trying to make them the parent a therapist. No, no, no. What I do is if you go to the dentist and the dental hygienist cleans your teeth, and then she shows you how to brush your kids' teeth and floss and how they're going to be in better shape when they come back. We say, what do you do in your routine? Something as simple as the way that we hold a baby to
Exactly.
nurse them is healing.
Yep.
And then they come back and their torticollis is better
Yep.
just by the way that they were holding the baby. And so we have them
Just natural
experience
routines.
that.
Have the power
Yes,
to make those natural routines just a little more purposeful. I
yeah,
agree.
exactly.
Hi, friends. Nicole here. Just a quick pause in the conversation to let you know about a couple of exciting things we have to offer you. When Lacey and I started having children many moons ago, and our friends were doing the same, they started asking us when they could expect their children to do certain things and how they could encourage their development. It was then that we realized there were resources that listed milestones and some that shared play ideas, but none that paired those together purposefully the way we did for families working in early intervention. So we decided to create that resource. For over a decade now, 123 Just Play With Me has been used by parents, therapists, physicians, and nonprofits to encourage traditional developmental play as the best way for young children to learn. Organized in a digestible card style format and color coded for the 5 domains of development, it is perfect for anyone caring or working for children ages 0 to 3. Our award winning product is available with free shipping every day at milestonesandmiracles.com or on Amazon. It makes a meaningful baby gift for new parents and a practical tool for early childhood therapists and professionals. In addition, if you are therapists, check out the professional tab on our website, milestonesandmiracles.com, to access discounts on individual courses we offer through MedBridge Education or for $101 off an annual subscription to unlimited continuing education courses. I personally use MedBridge for my own CEU needs and use their home exercise builder with amazing pediatric content, exercises, and educational sheets daily as an effective option for consistent follow through with parents at home. We hope you'll check it out. Now let's get back to the conversation. Let's talk a minute about research associated with TMR. I know through the years it's been growing. Can you
Yes.
give us kind of an update about the body of research that is there to support this work?
Sure. Well, there's been a lot of research on adult TMR, which is what TMR Tots is. The only difference is that in adult TMR, you as the patient will say raise one arm up and raise the other one up and see which one is easy, and then you can feel how that's connected to your issue, which might be knee pain. Okay. Instead, we have the parent feel and assist the child to move into ease, which is actually easier than somebody trying to figure it out themselves. Okay. And so, but the research has been done. And the very first research paper that was published in a peer-reviewed journal was on apparent hamstring shortening, treated indirectly by treating the trunk, looking for blocks in mobility in the trunk. And if you've ever had a twisted pantyhose or tights, and you can feel how, or a bodysuit, and you can feel how a pull in one place transfers all the way down into the legs, transfers up into the arm, you can understand this interconnection. And so if you go to the tmrseminars.com website, there's a lot of research that has been published. For TOTS itself, there have been 2 poster presentations that have been done. One was on CP and the other one was on torticollis. And there's another one that is coming up, which I can't share yet because it will be in November at the Pan Pacific Rehabilitation Congress, which is many countries coming together, an amazing poster presentation on the statistical difference of treating a child with CP starting with the TMR tot space. So So I'm looking forward to being
I
able
look
to put
forward to
that on
reading
the
that.
website. But we do have people that in evidence misunderstand what evidence-based is. David Sackett, that developed the concept of evidence-based, that it was a tripod. A tripod has three legs, but a lot of people are looking only at what is in a peer-reviewed journal, one leg. The other two legs are clinical experience. We have over 4,000 people doing hundreds of sessions, documenting stuff, and patient preference. And the therapists that are doing TMR have wait lists. Parents are, and every week I get messages from people around the world. Where can I find somebody to help my kid? Or I've been doing TMR with somebody, I'm moving, I'm so frustrated that the therapists don't understand that. So with the hamstring stuff, I say, hey, hamstrings are hamstrings, right? So why can't we just say, well, if it doesn't matter what the population is, but a lot of people are locked into the fact that it has to be in a pediatric journal or it doesn't exist, and that's not fair to our kids
Yeah.
to to wait 15 years. But we do have a number of places that are working on publication. My paper on over 100 children with postural asymmetry is sitting on the back burner because we have been advised there's too much information in there. We need a preliminary paper published first to refer back to. But it was a statistical significance, which brings me to another point too. When we are looking at one thing like a torticollis, so many people are unfortunately coming out of school or going to the therapist who look at one body area as the problem when frequently that's the symptom. Somebody might be having upper back pain, and where's it coming from? Their low back that isn't moving. The upper back is moving excessively and being strained. And the torticollis is not an isolated issue. And my research is that 25% of the treatment is to get the neck straight. The other 75% of the treatment is to get the body straight so that the child does not have uneven weight bearing, that the child does not possibly butt scoot or drag one leg a little bit or have asymmetrical crawling. They may be subtle issues, but the child still.
Digestive issues. I can't tell you how many kids I've had that after treating their trunk for torticollis and their pelvis, the reflux is better, the constipation's better, the latching is
Yes.
more efficient. There's so many other systems beyond just straight looking at their head position that improve that it's just this, it's been astounding to me.
Well, I do not just discharge somebody until their next motor milestone, at least one motor milestone, possibly two, are symmetrical, that the child can cruise easily both ways, that
Yes.
the child can, if they're a little older, that they can go up the steps easily, lifting the other leg,
Right.
even if they choose to go one at a time. And we have to look at the developmental implications. The
Yeah.
other thing about that too is the clinical practice guidelines, which I celebrate. We need guidelines, but the guidelines say that the children may have pain. We don't have pain. There's no pain allowed. And the guidelines also say that there may be associated issues like hip dysplasia, things that we have to look out for. We identify in the screening the 7 possible things that may be associated with the tort and comprehensively treat them. And so the child is has their whole body treated, total motions, total body,
Yeah.
total child, total
Very-
family,
So,
to
yeah.
all system, total
Love it.
systems.
I love it. I know, Susan, this is your life's work, and that is very evident in terms of what you've contributed to our profession and to all the children that we collectively pledge to care for. And I know that work has taken you to some really cool places. Um,
Yeah,
what are
wow.
what there's too many probably to name. We don't have enough time, but what are just some cool things that you've been able to do with this? Places you've been able to go?
Well, the one that was the most dramatic was a year and a half ago, almost 2 years ago, when I went to India. The therapists there were very open to anything to help the kid. And we didn't need to waste time trying to explain about the evidence and all this stuff because they just wanted to know how could they help the kid. And over the course of 6 days, they took all three levels of my class. And at the end of the 6 days, they were treating. We brought children in. One child had come from a village, 10 years old, had cerebral palsy, and had never had any medical attention. And at the end of this therapist that just took the course treating him, you almost would not recognize how much better he was. Not that it's a quick fix, because another child that we saw was breathing better. And inch by inch, over the course of months, may be able to bring his hands closer to his mouth and stuff like that. And so, but that was amazing, absolutely amazing. It was very emotional for me to see the videos of these kids happy, comfortable, and even with some of the therapists that we don't have that we might have a language barrier, it doesn't matter because of the simplicity. I treated. I did not treat. That would not be correct. I coached a parent in Europe, does not speak English. Her child has cerebral palsy. They told her the only thing that they could do was Botox and surgery. The child was lying on the mat, 4 years old, crying when they were trying to stretch her. She had never brought her hands to her mouth. Mother does not speak English, sat in her apartment with a neighbor translating the 16 hours of training for Tots 1, implemented the things. We went back and forth with a translation app to fine tune some suggestions of how when she'd say, how does this look? And so I was coaching her, much like I would coach a therapist who had taken the class. A couple of months later, the child is smiling and is bringing her hands to her mouth and sitting up much better.
I love it.
So, yeah, it's
I love it.
been amazing. We have people on 6 continents. Um, and so we stream to Asia the class on Friday and Saturday nights so that they can watch Saturday and Sunday. We stream the class Saturday and Sundays to consecutive weekends to break it up so people don't have their eyeballs spinning around from trying to be streaming. And next weekend I'm doing an in-person class in Lakewood, New Jersey for our Orthodox group that cannot do a Saturday class.
Wonderful.
So,
Okay, so Susan, if folks
okay.
listening want to find you, where's the best place to find you?
Well, the website is tmrtots.com. My email is tmrtots@gmail.com.
You're always
And
generous with your accessibility to others. I will say
I
that.
love to talk to people and answer their questions. I've had parents, I do what I call a discovery session. I'll just Zoom with them for 10 minutes or something and say, yeah, I think your child would benefit if I see, or no, well, they're a little asymmetrical, but everybody is. Don't not to worry, and help them hook up with somebody. And my office is at West Philly Wellness in West Philadelphia. And I have people come from out of state. We do a consult, maybe 2 hours. They might, if they stay over, we might do an hour the next day. We set up a care plan for them to bring back to their treating therapist. Lots of possibilities. And some of the children I see on an ongoing basis. I have hours there Sundays and Wednesdays, and I co-treat with my daughter, Dr. Beth Blum, who is a osteopath who specializes in craniosacral and visceral treatment. She strictly manual work, and we co-treat
I
some
love
of our
that.
complex kids.
I love that.
So, so you asked if I have any other thoughts, and I
Yes.
just would like to share this for parents and therapists alike. First of all, we can't do spot treatment. We need to stop doing spot treatment because everything in the body is connected. As I said, if a child's toe walking, it might be coming from the trunk, and we have to find what is missing to work on building blocks. Painful stretching is never necessary, and when we have a tear-free motion, a tear-free option, And remember that the neck is being straight is only 25% of the progress needed for torticollis. We have to look at the developmental concerns. We build on what a child can do, and every child has their individual strengths. We ask ourselves, why are we practicing what a child with a label can't do? Why would they learn any differently than any other child? There is no quick fix. Motor learning and the development of optimal control is a process. Unfortunately, many people are looking for that quick fix, that cookbook, and especially therapists without PAEDS experience, they are looking for something to get a child to sit up tall in an intensive or something, but it is often a splinter skill, not an experience that the child can own. And each child is individual, as I mentioned. And so I talked about the child with Down syndrome being flexed forward, a child with CP, if their pelvis is asymmetrical, may have difficulty and may never discover that they have glute control to walk. Or they might have incontinence or something. And the last thing is that I had a child recently who supposedly had ADHD. He was in fight and flight. He actually became regulated when we got him rid of his blocks by doing a fun activity, pretending he was on a skateboard and going deeper into the skateboard motion. And that put him symmetrically on his sits bones. He was bouncing all over the place in school. And then he could sit still and be regulated. Not that every child with ADHD doesn't need sensory integration, but what was his problem? What was his problem? It was the asymmetry causing him to be in fight and flight. So we work with the caregivers, help them understand, take off the pressure, help them see their child's strengths, not just what is not yet working. I never say can't.
Yeah,
I always say
no.
not yet.
And I will say, Susan, just personally, I just want to thank you for showing all of us our strengths, not just children, but a whole generation of therapists as well.
Well, thank you for the time. I'm glad to share and
I'm so
welcome
thankful
anybody
for,
to reach out.
yeah, I'm so thankful for your time. I know it's precious, and I'm excited to share this with so many people.
Great. Okay. Well, keep on making magic with the kids.
You too.
Help them find that hidden potential.
You too, my
Okay.
friend.
Bye
Bye-bye.
bye.
Hey, everybody. We just want to say thanks for taking the time to join us today. It's true for all podcasts, but especially for ones like ours that are hosted by small business women, that your support really does mean so much. If you've enjoyed what you've heard today, we hope that you'll go to Apple Podcasts or Spotify or wherever you listen to podcasts and hit the follow button. We want to ensure that you have a seat at our table for every important conversation we host, and following the podcast ensures your invite. As therapists and mothers, we've lived and learned that community is really what we all need and what helps us to be our best. If this episode reminded you of someone who could benefit from being part of our community, we'd be honored if you'd share it with them. At Milestones and Miracles, we believe that play builds brains, and it's a wonderful way for us all to stay healthy and happy. So no matter what your age, take some time to play today, and we look forward to seeing you next time.